Hi everyone, welcome to my YouTube channel. This is Rxhubs. Today we are going to discuss on introduction to pathology. Pathology is derived from two Greek words. These are logos and pathos. When we say logos, logos is studies from a Greek word, while pathos is disease or suffering. Pathology literally is the study of disease. Pathology it can also be a scientific study of structure and function of a body in disease. It deals with causes, effects, mechanisms, and nature of disease. Pathology is devoted of the study of the structural, biochemical, functional changes in cell, tissue, and organ that underlie disease. We have uses techniques in pathology. These techniques include molecular, microbiologic, immunologic, and morphologic techniques. Pathology itself it attempts to explain why and wherefores of the signs and symptoms manifested by a patient, while providing a rational basis for a clinical care and therapy. That is to say, pathology it involves why and whereof, and why does the disease occur and whereof, and also shows a sign and symptoms. Pathology itself serves as the bridge between the basic science and clinical medicine. It is the scientific foundation for all medicine and is the basis of entire medicine itself. We have four main branches of pathology, and these include histopathology, medical microbiology, and hematology and chemical pathology. Histopathology have to do with study of disease that is manifested by a tissue, while medical microbiology have to do with microorganism. Hematology have to do with blood, while chemical pathology have to do with biochemical process of living things. The study of histopathology is divided into two, which are general pathology and systemic pathology. The general pathology is concerned with the reactions of cell and tissue to abnormal stimuli and inherited defects, which are the main causes of the disease. That is, while that of systemic pathology, it examines alteration in specialized organs and tissue that are responsible for that involve these organs. So the general pathology it includes the all body defects, while systemic have to do with specific organs, include like heart, kidney, lungs, and the rest of systemic organs. There are four aspects of the disease process that form the core of pathology, and these are: we have etiology, pathogenesis, morphologic and molecular changes, and clinical manifestation. We have to understand these four things in order to understand pathology. When we talk about etiology involves the causes, what cause diseases, while pathogenesis, that is the mechanism of its development. Morphologic and molecular changes, it involves the biochemical and structural alteration induced in that cell in the organs of the body. While clinical manifestation, this is a functional consequence of the disease changes. There are some definition that we have to understand in order to there are some definition that we have to know in order to understand pathology. We have to know patient. What is patient? Patient is the person that is affected by the disease, while lesion are the characteristic changes in the tissue and a cell produced by the disease in individual or experimental animal. While pathologic changes of morphology, it consists of examination of the disease tissue, and the pathologic changes that can recognize with a naked eye, that is grossly or microscopic changes, or studied by a microscopic examination of a tissue. The causal factors responsible for this lesion are included in etiology of the disease. Also, the mechanism by which lesion are produced is termed as what? Pathogenesis of disease. When we talk about pathogenesis, it has to do with a mechanism by which a lesion are produced, while the functional implication of a lesion felt by patient are symptoms, and those discovered by a clinician are the physical signs. The clinical manifestation, the clinical significance of morphologic and functional changes together with the result of other investigation help to arrive at answer to what is wrong, that is the diagnosis, and what is going to happen, that is prognosis, and what can be done about it, that is treatment, and finally what should be done to avoid complication and separate, that is prevention. So also always when we are dealing with pathology, you have to understand what's wrong, that is the diagnosis. You have to understand what's going on, that is the prognosis, and what is have to be done about it, which is the treatment, and finally what should be done to avoid that complication and separate of that disease, which is the prevention. Histopathology, the study it includes the structural changes observed by a naked eye examination and the changes detected by a microscopic, supported by numerous specialized staining methods, which include biochemical and immunological changes to arrive at the most accurate diagnosis. There are modern time anatomic pathology, which includes super specialties like cardiac pathology, that is have to do with heart, pulmonary pathology, this one concerns with lungs, neuropathology have to do with brain, renal pathology have to do with our kidneys, gynecologic pathology, this one have to do with reproductive system, while dermatology have to do with skin, and gastrointestinal have to do with our GIT. Anatomic pathology include the following three main subdivisions. These three main subdivisions include surgical pathology, forensic pathology, and autopsy work, and also cytology, which is the last one. The surgical pathology is deal with the study of tissue that is removed from the living body, while forensic include the study of organ and tissue removed at post-mortem, that is a dead body, while cytology it include the cell shed off from the lesion, that is the exfoliative cytology, and a fine needle aspiration cytology, that is FNAC, of a superficial deep-sighted lesion for a diagnosis. We have come to the end of our tutorial. Thank you for watching. Please don't forget to subscribe.